So this is part two. We're going to finish up the head to toe assessment. So we got all the way through the abdomen, and now we're going to finish with the lower part of your patient. So what we're going to do is we're going to ask your client to roll over on their side, and we're going to assess for edema on the posterior buttocks. Thank you. And again, you can scan them all the way from top to bottom, but you're looking for edema because edema is called dependent. It settles in the dependent area. So Mrs. Smith has her head up and she has her feet up, so the edema may go to her sacral area. You're also looking to make sure the skin is intact and there's no signs of breakdown or pressure points because of her lying in bed at this point in time. Okay, you can come back. Thank you. All right, so circulatory status. Let's do our femoral pulses. Femoral pulses are very deep, so you have to get kind of down in the groove between the thigh and the groin area. And they're very, very deep, so you may or may not feel them, but go ahead and try. And again, we're comparing on both sides. That's a good one. And then we're doing a popliteal. And how I do popliteal is I go around the knee with both hands. And it's going to be located on the inner aspect, but for some reason it just helps me to kind of hug. And then I'm putting my fingers in the space in between the tendons that's running behind the knee. And just apply gentle pressure. And again, you're comparing both sides. Now don't feel bad if you can't find them, because again, they're deep, they're a little hard to find. So then go to posterior tibial. They're going to be on the inside of the ankle, right behind the malleus bone, and apply pressure. And these are pretty superficial, so you should be able to feel these. Again, comparing on both sides. The last pulse is a pedal pulse. It'll be right on the top of the foot, between the first and second toe usually. And with light pressure, again, just kind of trap it between the bone and the end of your fingers. Good. Now when you're describing these pulses, again, you're going to use your scale of 1 plus 2 plus 3 plus 4 plus, and you're going to describe all of those when you're doing charting your head to toe assessment. So Mrs. Smith has 2 plus, regular, normal pedal pulses bilateral, and I would state that about all of hers. Next, I'm going to just look at skin integrity, and we would have a bath blanket or something across the top of her for privacy. But checking skin integrity, again, for any lumps, bumps, bruises, skin tears, areas that may be forming pressure, especially the heels. You want to make sure the heels are intact. Any surgical scars, anything of that nature, because we want to document any abnormalities. So that looks good. Let's check skin turgor. See if she's having any tenting, and she's not. Good. And then again, we're looking for edema, so palpating for swelling. We have none. Now we already talked about in class how it could be pitting or non-pitting, so you would want to chart that. Okay, capillary refill we need to do again because we're checking circulation to the lower extremities. Always do it bilaterally. Good, less than 3 seconds. And now we're going to check strength of her feet. So first we're going to ask her to push on our hands like a gas pedal. Mrs. Smith, will you please push on my hands as hard as you can? Good, all right. And then the next way, she's going to pull her toes up towards her nose. So Mrs. Smith, I'm going to put my hands on your feet. And on the count of 3, will you pull your toes up towards your face? 1, 2, 3. Good. Very good. All right. The last thing we're going to check for is what's called the Hohmann sign. And this is a sign that helps determine if the patient may have a deep vein thrombosis. It's not conclusive. Usually only about 50% of patients who do have a deep vein thrombosis have a positive Hohmann sign. But it's part of the assessment process to help determine that. So you support the patient's leg and then instruct the client, Mrs. Smith, I'm going to pull your toes towards your nose. And if you feel any sharp pain in your calf, I need you to let me know. Okay? So 1, 2, 3. Any pain? Nope. No? Okay. Same way with the other leg. 1, 2, 3. Any pain? Nope. No? Good. Okay. So that concludes the head to toe, hands-on part of your assessment. Part of your exit, before you leave the client's room, make sure, again, reassess the pain, make sure they're in a safe position, check out any tubes, any, like oxygen, Foley catheter, IV, any of those things to make sure that they are running appropriately or draining appropriately, that they're in appropriate position. Make sure your bed is down, bedside table's within reach, your call light is on the side of the bed, hand hygiene. Mrs. Smith, that went really well. I'm going to go ahead and go document that so the physician has that on record for when he makes rounds today. Is there anything that I can bring you?
No, thank you.
No? Okay. And your pain again, would you do a rating for me? 0 being none, 10 being the worst.
I would say it's at 0 now.
At 0? Okay, very good. I should be back in about half an hour to check on you. If you need me before that, please feel free to use your nurse's line. Okay?
Thank
Thank
you.
you.